With the invention of robotic surgeries in the joint replacement industry, nowadays patients are started recovering very fast. जैसे मैं बताऊं कि after 6 to 7 hours of the surgery, patient starts standing, walking, and using the washrooms on his own. So by the time of the discharge on second or third day, patient is doing all his regular activities like eating, going to the washroom, moving around, doing the stairs on his own without any support. उसके बाद घर पे जाके patient has to undergo some physiotherapy to recover it faster. अगर बाकी एक्टिविटीज की बात करें तो स्पेशली फीमेल स्टार्ट्स going to the kitchen by 7 or 10 days and started preparing food to some extent. We usually advise patient not to go out till 15 to 18 days till the time stitches are out. Once the stitches are completely healed and out, then patient can start moving around, going out, going for the small walks or going for small functions outside. अगर बाइक या 4-wheeler चलाने की बात है, after the stitches like 2 to 3 weeks patient can start using the 4-wheelers. बट हम बाइक के लिए थोड़ा पेशेंट्स को रुकने के लिए बोलते हैं 1 से 1.5 महीने तक. We usually advise them not to do the 2-wheeler riding because they have to recover and regain the strength in the lower limb muscles. By 45 days or 1.5 महीने के बाद they can easily do a 2-wheeler riding.